Oscar Garcia. I head the Mountain View Chamber of Commerce, and I want to welcome you to this morning's breakfast briefing on the Affordable Health Care Act. Last year, I flew out to DC a couple of times, and I had the opportunity at one of the events to meet Saul Ross, and I'm not joking, we were literally like, there was a group of maybe about 50 or 60 business folks from throughout the country that were meeting with the White House and an organization called Business Forward, and we had a breakout session. We were literally like tucked in a corner, about a dozen of us, and Saul happened to be the gentleman that was talking about healthcare reform, and I reached out to him, and from there, this came to fruition, but it really wasn't the chamber. I do also want to thank the El Camino Hospital, Kaiser Permanente, and Lucille Packard Children's Hospital, and Palo Alto Medical Foundation, because we actually had started talking about putting together a healthcare event several months ago, and we were brainstorming, and we decided to invite Saul, and also from Michael Lujan from the state of California. So I do want to thank, again, Palo Alto Medical Foundation, particularly Cynthia Greaves, for hosting this. It's a beautiful, gorgeous facility here, so thank you very much, Cynthia. And also, behind, maybe some of you saw that we do have some tables there from Lucille Packard Children's Hospital, which it's kind of a good thing and a bad thing, because if you notice, they're making you feel guilty by having that rethink your drink sign up there showing all the sugar. But no. Oh yeah, see, and they did, they are like 2 tables away from where the pastries are. So thank you very much for being here. And then also, of course, El Camino Hospital and Kaiser as well. So thank you very much. And feel free afterwards to stop by and get some information from them. So let me recognize a couple of folks from our local elected officials that are here. We have, is Ann Ream from, is she here yet? No? Okay, she will be from Office Congresswoman Anna Eshoo. And then we also have Joey Vaughn with the Office of State Assembly Rich Gordon sitting in the back. Thank you very much, Joey. And we also have a couple of board members. I already mentioned Cynthia Greaves. She is our board member. And then our current board chair, Sherry Sager with Lucille Packard Children's Hospital, sitting in the back as well. So thank you. Okay, let me introduce our first speaker, Saul. Just a quick background on Saul. He is currently serves as the Director of Private Sector Outreach in the Intergovernment and External Affairs Office for the Department of Health and Human Services. He is the liaison between the business community and the Department on Affordable Care Act. Literally, he is our direct contact with the business community. So if you have any questions, he's the guy to talk to. Previously, Saul worked for several Fortune 500 companies. One of them, in particular, a company called Bearing Point. And what he did is, one of the things that he did is he helped create the Hurricane Katrina Task Force, which contributed over $1 million in pro bono assistance to the affected region. And he also, what he did is he cut the budget for state consultants. So if you're a consultant in this room, don't ask him for a work. No, but he also established the Government Affairs Committee for Tech America and was the vice chair on the committee in its inaugural year. Our second speaker, and he's going to be joining us via online kind of WebEx, and Michael Lujan. Michael is the Director of Small Business Health Options Program, or SHOP as it's known, and he is responsible for the design, development, and implementation of the employer group coverage designed for small businesses. He has over 25 years of working with small businesses, business employee benefits, and previously Michael also served as the Director of Small Group Sales for Blue Shield of California. So, Saul, you're up.
Thank you very much. I just want to make sure everybody can hear me. How close? Is this good? Is this a good level? Okay, great. Close my mouth. Oh, this is lovely. Okay, so good morning. My name is Saul Ross. I am from Health and Human Services. I work in the Office of the Secretary. I'm her Director of Private Sector Outreach. I am the guy from DC. However, you need to know that within the room right now, you also have your local HHS representation. A guy named Ken Shapiro. Ken, can you please stand up so everybody can see who you are? This is the guy who's here locally for you. He is the executive officer for Region 9, which has California, Arizona, Hawaii, Guam. I'm sure I'm missing one. Nevada. That's a big one, yeah. I kind of shouldn't miss that one out. So he's the boots on the ground here, right? So I come in, I have the easy job. I fly in, I tell you everything, I tell you as much as I can, I answer your questions, and I leave. And he's stuck on the ground here, having to actually deal with all the follow-up. So I feel badly for him because all the questions that you're going to ask me that I'll say I'll get back to you on, he's probably going to have to help coordinate the follow-up. So in saying that, I'm going to give you a couple of quick things before I dive into what I normally talk about, which is I want to give you a bunch of resources that you can go and try and get some answers from on the website. And I'm also going to do something that most federal employees don't normally do, and Oscar's very acquainted with this next part of it. First of all, healthcare.gov, that is our website for the Affordable Care Act. That is the one-stop shop. That is going to end up being the federal marketplace. Now, Cover California is going to have their own portal, so that's, you guys will have 2 different ways to get in. But that is the main resource right now for federal information flowing down. You've got a couple of ones, I want to make sure I read them off correctly. There's ccio.cms.gov, so it's ccio.cms.gov. CCIO are the folks that are actually creating the marketplaces, right? They're the ones that are responsible for the day-to-day regulation and regulatory oversight of the marketplaces. So ccio.cms.gov is your stop there to find out what's going on with the marketplaces. Any regulations that are dealing with the marketplaces are also posted there as well. SBA.gov/healthcare. So SBA is one of my partners in talking to the business community at large. We've done a series and continue to do a series of webinars with all of our SBA counterparts to get them, to help them educate the business community that they deal with on a daily basis. SBA has 10 regional offices, they have 62 district offices, they have 5,000 federal partners. So that's an army of people who are able to go out and educate the public on the Affordable Care Act. So sba.gov/healthcare. The next one's important for all business owners in the room. It's irs.gov/ACA. That is going to be your one-stop shop for all of the IRS provisions within the ACA. So employer shared responsibility, how penalties may apply to you, and all the and pretty much all of their regulations are on that website. It is not the prettiest website, I'm going to warn you right now, but it reads like an encyclopedia, but it does have a ton of knowledge. The last one is dol.gov/EBSA/health reform. And what that is that's Department of Labor's Employer Benefits Administration's website. That is going to talk a little bit more about the hours per week rules that you've heard about. That full-time is defined as 30 hours, and you have a 9-month look-back period or a 90-day look-ahead period for new hires, and 9-month look-back for current hires starting next year. So that's dol.gov/EBSA/health reform. So do you need
say that again, please?
Sure, yeah. dol.gov/E as in Edward, B as in bank, S as in Sam, A as in Apple, /health reform.
A technical comment, I'm 90% sure those are forward slashes.
/. Thank you. Thank you. I should know that in Mountain View, shouldn't I? /, not /. Gotcha. And then here's the last piece of this, which is you guys are going to have the ability to ask questions today after I speak and after Michael speaks. There's going to be on cards. I guarantee you that some of you will have questions that do not get answered. In that case, you are going to write down the next piece of information, which is my email address. This is the part that most folks don't usually, you don't normally get this out of people who are getting up and speaking, especially from DC, because we try to, manage our inbox. I manage my inbox daily because I'm on the road doing these things daily. So it's sol.ross@hhs.gov. I was going to say, if you see, if it's on my bio, I'm going to repeat it a couple times, don't worry about it. It's sol.ross@hhs.gov. And so here's the deal. Email me, ask me your question. I usually respond within about, within minutes, a day, at least saying, I'm on this, I'm working on this, or I'm gonna hand you off to somebody else and say, this is the right person to actually do to get your answer. In the event that your email slips, you have a 3-day waiting period. So you have 72 business hours to hear back from me. If you do not hear back from me in 72 business hours, you then resend your question with a new subject line, which is "Hey idiot," because I sort my email every day on "Hey idiot." Over the last month, I've had exactly 2. So out of the email volume that I have, and we run through. When I started this job, I had about a 3-month run of emails that I could archive. Then it got down to about a month towards the end of last year, and now I'm down to I have to archive weekly. So you know that I'm not dropping emails at all. I'm trying not to drop emails at all, but based on doing this. So hey idiot to sol.ross@hhs.gov. Okay, that is if I have missed your email. You can also substitute something else for idiot depending on your opinion of me. That's you can figure it out now later. All right, so now the Affordable Care Act. I'm assuming that everybody in this room has a base level of knowledge knowing that, number one, it is the law of the land. It was passed in 2010. The Supreme Court upheld it. The president got reelected, so now everybody's faced with the implementation of this law. There's a couple of basic provisions that apply to small business within it. The 3 that we like to talk about are the small business tax credit, which put simply, 25 or fewer employees, the employer pays 50% or more of the insurance premium, and the average salary is $50,000 a year or less for the employees, not including the CEO or their family. The employer is then eligible for a tax credit of up to, right now, 35%. Next year that goes up to 50% of what they paid for the premium. That's for for-profit businesses. For not-for-profits, it's 25% now and 35% next year. Okay? So there's abilities for business owners to get real savings right now in their pocketbook by providing health insurance, but the truly small business owners to provide health insurance to their employees. In 2014, we've got the marketplaces that open up. Obviously, you see, covered California as California's shop, and so that's going to be a place for business owners to go and online get their insurance to be able to compare apples to apples, oranges to oranges, the products that are out there. That is going to be also the only way. Now you can do your tax credit through your tax preparer, but the only way to get your federal credit is to go through the website, through the marketplace itself. You don't have to go through the website, but you have to go through the marketplace. And there's a few different ways that you'll be able to do that. You'll be able to do in person, over the phone, and online. So that's the small business tax credit. We want to make sure that folks understand that is available. It's been available since 2010, so you can amend your taxes going back to 2010 on it. You are not compelled as a small business owner if you have 50 or fewer employees to provide health insurance to your employees. So this is the other thing that you have a lot of small businesses. I get at least 1 email per day from a small business of anywhere between 10 and 20 people saying, I can't afford to cover all my employees next year. This is going to, this mandatory coverage is going to kill me. And no matter how many times I say it, I still get the question. So 49 or fewer, 50 or fewer employees, you are not compelled to provide healthcare coverage. So that's another portion of the ACA that we like to talk about. 2 other ones that are pretty important are medical loss ratio, which also you may have heard of the 80-20 rule, and rate review. Put simply, medical loss ratio is making sure that the insurance companies are spending your premium dollar on providing care and not on other overhead pieces, right? So it's not on salaries, it's not on bonuses, it's not on corporate jets, it's not on perks, right? So it's 80% in the individual market, 85% in the large group market. So it just means that they have to account for how they spend their money. Last year, $1.1 billion flowed back to the people of the US from the insurance companies because they didn't hit those numbers. Rate review is a public review process for insurance companies to go through when they decide to when they want to raise rates over 10%, over the 10% threshold. About 8-10 years ago, NAIC, which is the National Association of Insurance Commissioners, did a study on what really drives the costs of premiums to go up. And what they found was at the threshold of 10% and below, it was really just the cost of doing business. And then there was a gap between 10% and about 20%. There was still some in there, but it was kind of like a bimodal distribution. And then about 22%, it really picked up again. And so what they found was that 10% in threshold and lower ended up being more of the cost of doing business, right? That was salaries going up moderately, cost of living, cost of papers going up, however you want to talk, whatever, rent goes up. It's basically just incremental costs. And above that was a repositioning of the product within the marketplace to get a higher profit rating. So that's where that delineation came from. It wasn't just an arbitrary number that we picked out of the air. This was done off of a lot of thought from NAIC, and we literally looked at that and said that's a great delineation of where this rate review process should go. So those are the three provisions I usually talk about. Going forward right now, I'm sure you know, October 1st this year, open enrollment comes up. So we have a challenge right now of making sure that folks understand exactly what open enrollment is, which is making sure that the marketplaces, that people have access to the marketplaces, making sure that people have access to the information that they need to get themselves covered. Employers, employees, business owners, their consumers, right? So we have that's a huge challenge. It starts on October 1st. It is actually an extended open enrollment period this year. It goes for 6 months, so it goes through 2013 all the way to the end of March in 2014, which is usually about over 3 months longer than what it would be. And that is, those are like the main barriers for us right now. Not even a barrier, but those are the main goals for us. Like right now, I see October 1st as kind of as the next major milestone in what we're doing. Let me tell you what I'm doing to get to that point. So right now, we are trying to figure out the best ways possible to reach the general public on how to get to the marketplace, what the marketplace is going to look like. California is a different animal because you guys have an outstanding program in place. You're one of the 17 across the country that are just doing a state-based marketplace. It makes my job a little easier because California is actually far down the road versus some of the other states. Right now, I'm working on a challenge of trying to figure out within the demographics that really need to get into the marketplaces, the folks, the single moms, the young and healthy, the sort of the sick and scared kind of those demographics that haven't traditionally had insurance, that because they've had pre-existing conditions or because of insurance they haven't had choices and they haven't had the ability to get insurance in an efficient manner, making sure that they understand what's out there. So I'm trying to partner with, we're bringing in, we brought in folks from advertising, we brought in the pharmacies, we brought in the quick serve restaurants, and we're continuing to bring these folks in. We're bringing in philanthropic organizations to try and figure out the best methods on how to hit the largest populations with our messaging, which is you need to get covered. You shouldn't be using the emergency room for primary coverage. Wellness is a huge piece of the ACA, so we want to make sure that you're taking responsibility for your own for your well-being. So instead of, like we're saying, rethink what you drink back here, that's a beautiful thing, because that's, lowering the sugar content that you're getting in on a daily basis, making sure you're walking, if you're going up one flight of stairs, if you're, instead of taking the elevator up one flight, take the stairs, go down to, you walk down 2 flights of stairs. So I talked to different companies about their wellness provisions and how they can team up. Tomorrow, I fly to Chicago, and I meet with Mayor Emanuel's team on Chicago's wellness and their prevention strategy. So how they are actually going to integrate this into the daily life of folks within the city. Yesterday, I was in Miami meeting with a couple different companies on their demographics. So this is kind of, this is what my life looks like right now, is really trying to help tie some of the loose ends of where we're at in the ACA together. With that, I know that there's also some consternation from the business community on employer shared responsibility payments, which, that's, if you decide to not offer coverage, you have, IRS has said that there's 2 different levels of payment. There's $2,000 per year per employee, there's $3,000 per year per employee. I don't know if we want to go into that specifically here, but I'm more than happy to answer questions either offline about that, refer you to the IRS folks that have that, get the right information in your hands. Hopefully our SBA folks will also be able to talk about this a little bit more cohesively in the short future, because we are getting IRS to train them as well on all of the nuances within the provision. But let's just, a brief overview is there's 2 different levels, 2,000 and 3,000 per employee after the first 30 employees for companies that have over 50 employees. Now I realize that's a lot, so let me say that again. There's 2 different levels, 2,000, 3,000. It's for companies that are over 50 employees, that have over 50 employees, and that they have to meet certain criteria within the Affordable Care Act to even trigger it. So number 1 for these is you have to offer comprehensive and affordable coverage. Affordable coverage is defined by not exceeding 9.5% of the gross salary of the employee for their salary. So it can't be expensive, right? It can't go over 9.5% of their salary. It has to be comprehensive. It has to hit the coverage has to cover 10 essential health benefits. So we talked about EHBs last year. They're based state by state. So that's the deal for comprehensive. They are based off of the state plans in the state. So it's not the federal government saying that you have to cover these 10 benefits and this is how you do it. Individual state mandates still apply. So what happens in California is not the same that happens in New York, is not the same that happens in Illinois, Texas, Maine, New Hampshire, et cetera. So you have those employee thresholds. If you do not make an offer that is, if the employer does not meet those criteria, does not offer that coverage, and the employee goes out and gets a tax credit on the individual marketplace. So that means the employee has to fit within a certain criteria as well, right? They have to fit in this 133 to 400% of income tax level, and they have to go to the individual marketplace. They have to go and get their insurance there, get a premium tax credit. Then that's when the trigger starts. That's when the clock starts running on your employee count. But there's other different ways for your employees to get insurance, right? Spousal coverage, they can get it through their spouse, in which case the employer's not required to, that employee doesn't count towards the employer's number. They can qualify for Medicaid. There's a Medicaid expansion going on. I'm sure you've heard about it. We're actually in the process of negotiating with different states on different levels on how to get expansion throughout the states. So those are 2 qualifiers right there that tend to lower the numbers. And this is where we get a lot of consternation from the business community, because they hear this, it's 50 employees and I only have 30 that cover, I got 400 employees, it's gonna cost me. I went through this with one of the companies yesterday. They came up with a figure of about $180,000 a year for their company, for their franchisees, they had about 200 per franchise, right? So in running those numbers, I started asking these questions, like, how many of your employees qualify for Medicaid under the new Medicaid expansion rules? How many are going to get employer coverage from their spouse? And as I start running those numbers, I'm actually meeting with their CFO next week to talk about where their actual true costs lie. And so once we just did some back of the envelope, pencil and paper, we got from $150,000 down to about $25,000. And that was just back of the napkin trying to figure stuff out. We're actually gonna crunch the numbers, throw it into a couple of Excel spreadsheets and generate a hard and fast number for them. It is a national chain that has franchises in every state. And I drove by 2 of their stores on the way down here. So there's a lot of consternation about this. There's a lot of mixed messages going out there. There's a lot of lack of information on all sides, lack of sensible information on all sides, because IRS, for one thing, they're in the middle of tax season right now. So they're stretched extremely thin on getting taxes done on April 15th, because that's their major milestone that's happening in 2 weeks. So I understand that that's not a great, not a great reason for you guys to not have as much information, but I guarantee you that you will see a lot more forward-flowing information from IRS. We're going to be a lot better about it. SBA is going to take the mantle on that as well. So I wouldn't get one of the things that I counsel people is talk to your other business owners that these numbers look scary on the face of it, but when you actually start drilling down into who you're actually going to cover and how you're going to cover them, it becomes a lot more manageable. One of the things that folks also tend to forget, if you drop coverage, so that's where the $3,000 fine tends to come in. If you drop coverage, you are not only getting fined, which is not tax deductible, you are also losing out on the tax deduction that you were getting for sponsoring your employees' coverage. So you're getting a double whammy on your balance sheet. And this is the other part that a lot of employers tend to forget about or tend to overlook, which is they're already getting a tax benefit by a tax break or a deduction on their taxes each year from providing employee coverage. So the penalty is not tax deductible, and you're losing out on another tax deduction. So it's a double whammy on the end of the year balance sheet. And this is another part that business owners tend to forget about. And if they don't forget about it, they undercut it. And when we start really diving into the numbers, when I sit down with them and we pour through numbers on an Excel spreadsheet, it really starts to turn that aircraft carrier around. I know that was a lot in a little bit. I got so much more I would talk about, but I also want to be respectful of Michael's time, who's going to be joining us from Covered California. I'm happy to answer questions afterwards. You have my email address, saul.russ@hhs.gov. I spent a lot of time in airports. I have my BlackBerry on me right now. It's buzzed 3 or 4 times since I've been in the meeting here, so I guarantee you there's going to be a hey idiot somewhere along the lines today. But I really thank you for your time. Thank you for hosting us here, and thank you very much.
Thank you, Paul. So we're going to leave plenty of time, about 30 minutes for some Q&A. I think there's some 3x5 cards going around. So if you can write down your questions, and then we will collect them. The other thing too that I want to thank is some of my colleagues at the other chambers: Steve Van Dorn with the Santa Clara Chamber of Commerce, Julie Rose, Los Altos Chamber of Commerce, and Don Middleston with the Sunnyvale. Thank you so much for helping us promote this event, and actually a lot of the other county chambers as well that helped us. So thank you again for promoting and being here. All right, we're going to have Michael now join us.
Yes, Michael, can you hear us? Oh. Let's see. Go ahead, keep the crowd speaking.
Okay, are you guys writing down your questions?
Sorry, the audio just went out on the...
We'll just be a minute. Here, let's try answering some questions. Here, let me see. Casper,
Michael?
can't read it.
Yeah, I know, the
Yeah.
audio just went down.
I can't read it.
The tax credit. It's
Yes, I heard that
means-based.
too, and then all of a
Is
sudden it
based
went
on
down.
Earned and non-earned income only, or assets?
I'm going to...
Income only, it's not
It's
assets.
earned and non-earned.
Go ahead and repeat the question.
So the question actually is one that, congratulations, it's the first time it's been asked in a public forum since I've been doing this for the last 20 months, which was...
Kind of important.
It is. It's laid out actually in the reg, but it's not something that folks usually delineate, which is, I want to make sure I have this right, that it's income, it's earned and non-earned income, as well as, and then also assets based. And the metric for figuring out the tax credit is earned income. So it doesn't take the other pieces of that into account. So it's, if you're paying your employees' salaries and then, I don't know, providing them a transportation benefit, that transportation benefit is not taken into account in the back end. Is that, am I getting there?
No, I'm thinking more on an individual basis, whether you qualify for it or not. If you own a house that's worth $300,000 and you pay zero income, or
Yeah, so that doesn't have a bearing on either the individual tax premium credit or the employer credit. The assets don't. It's strict income based.
strictly income. Okay.
It's a good question, though. Write that one down and put that in our FAQ, because that's actually helpful. Thank you.
Okay.
Yep, I can hear you. Well, on the phone.
We're going
Only
to
on
the
the phone.
phone, our audio went off on the computer. Can everyone hear him?
Hello, testing 1, 2, 3.
Yes, we can.
Okay.
All right. You guys are good sports.
Hi, Michael. This is Oscar with the Mappy Chamber of Commerce. So thank you so much for joining us via the phone, the web. So we'll go ahead and turn it over to you.
All right, well, thank you very much. With all of this technology, I'm relying on an iPhone, so I hope I hope this works for you. Just checking one last time. Can you hear me okay?
Yes.
Yes.
Okay, great. Well, good morning, everyone, and for these reasons, I'm really sorry I'm not there in person, but I appreciate your allowing me to present via GoToMeeting. It normally works, so I'm not sure what's going on here. I wanted to speak briefly, and I wanted to also thank Saul for setting the stage with a lot of the detail that I normally go through with my presentation. That'll, I think, allow us to spend more time with doing some Q&A. I don't have control of the deck, so if you could advance the slides, I appreciate it.
There you go. It's on today's purpose.
I can't see it.
We're on slide 2.
Uh-oh. Oh boy. Okay, give me just a second. I'm actually opening up my own PowerPoint here. All right, well, so for today's purpose, really wanted to provide some information, happy to have opportunities like this to speak to actual small and large business owners who want to get information. Very briefly, we'll describe a little bit about what's happening specifically in California and how SHOP is going to be different than the non-exchange marketplace in 2014. I think some of this has already been discussed around what defines a small business, who can enroll, what's available. We'll go into a little bit more detail. On the next slide, on slide 2, SHOP, we try not to use acronyms too much, but SHOP stands for Small Business Health Options Program. As Saul described, the states have the ability to create either 2 separate pools, a small business and an individual, or one common pool if the state prefers to have one risk pool with both individual and small group. In California, we created 2 separate pools, so what I'll be describing today is the Small Business Health Options Program known as SHOP. All of this, of course, is in follow to the Affordable Care Act, fulfilling the requirement that every state either create or partner with the Fed with developing their state's exchange. Very proud to say that California was the first state to enact enabling legislation that effectively raised our hand and said, yes, we'll build our own exchange. A state as large as ours with experience as we do, as we have, it made good sense for California that we would build our own exchange. Next slide. As I mentioned, we have the individual marketplace and SHOP. I think for small business, you need to know about the individual exchange in as much as there may be advantages for some of your part-time employees to enroll in the individual exchange, some dependents that aren't covered on your group-sponsored plan, and maybe even employers who say, comparing the options available to them, the individual exchange may make good sense for them too. So I may go back and forth. A majority of my discussion is around SHOP, but I think it's important to understand what's available in the individual market exchange as well. To slide 4. The new marketplace, and you may have already heard, and I was happy to hear Saul use the term health insurance marketplace. We've sort of moved away from using the term exchange. I think the marketplace, especially here in California, is crowded with a number of new entities that are calling themselves private exchanges. And I think all of that's great if it means more competition for small business employers. But we do call ourselves the health insurance marketplace, which I think makes a little bit more sense to consumers. I don't think they really connected with the idea or the word exchange. And again, the value of the exchange is to provide small business owners options that aren't currently available in the marketplace, and to give them new transparency and new tools to make shopping, comparing, and managing their health insurance for their employees more efficient. On to the next slide, on slide 5. I think Saul gave a pretty good overview of this, but in case you missed it, for California, 2014, we define a small employer as a company with fewer than 50 employees, fewer than 50 full-time equivalent employees, and we'll go into a little bit more of that definition. The shop exchange will expand to larger companies in 2016, where employers with fewer than 100 full-time employee equivalents, and in 2017 to larger employers with over 100. To clarify for California, there might be some differences from state to state. Sole proprietors or self-employed persons would be not a group, but eligible for the individual marketplace. It's a common question we get. There's very many self-employed persons, and while yes, they are a small business, for purposes of qualifying for insurance, they would not be a group until they have one employee on payroll. Moving to slide 6, for those large group employers, this is where a lot of the confusion happens, where it's not entirely clear to many business owners who is or isn't mandated to offer coverage and who does or doesn't have a penalty. This slide is a simple clarification to say it's applicable for employers with 50 or more full-time equivalents who A, don't offer the minimum essential coverage, or B, don't offer affordable coverage based on what Saul already described as the 9.5% of household income test. Minimum value, we'll talk about that in a little bit. Having adequate coverage is a new threshold that might be new to small employers. What that effectively means is the coverage has to meet the minimum essential benefits and the minimal comprehensiveness, meaning it has to have at least 60% of actuarial value in order to be deemed a minimum value plan. And we'll talk about that on an upcoming slide. To clarify, in the exchange, we have in the individual marketplace, you'll have the traditional companies that you're used to seeing. I think they allow us to say some of their names. Kaiser and Blue Shield and a couple other plans have all already said, please use our name as a bidding company. Some of the other plans, we had a number of plans that expressed an interest to participate in the exchange. So you'll see the traditional plans that you're familiar with, but you'll also see in the individual exchange new plans that aren't typically commercial plans. These might be local initiative plans, Medi-Cal plans, health plans that aren't typically offered in a commercial offering. Likewise, in the individual market, you have advanced premium tax credit. This is where the consumer actually gets an advanced tax credit to help pay for the premiums. And of course, the online tools to enroll. We'll have a lot more options to enroll, including online, telephone enrollment, and of course, paper and fax. In the shop, it's employee choice. Employee choice means that the employer will have the ability to set a budget saying of the 4 metal tiers, bronze, silver, gold, or platinum, an employer can look at all of the available plans offered in shop, set their budget accordingly and say, for example, they decide that they can afford the silver level of coverage, the employees would in turn be able to pick any plan in that silver metal tier. And I have another illustration that shows that in more detail, but that's a very appealing feature for SHOP, where most small businesses today may offer a single plan or maybe two plans. You'll be able to now in SHOP offer a full menu of plans with multiple insurance companies being offered. And also an important point, the premiums will not be loaded particularly for that choice. There are some private exchanges that exist today or have in the past who make that available, but they charge anywhere from 15 to 30% additional premium or a load to that premium for that choice. That goes away in 2014. In the SHOP, employer tax credits are also applicable only in the SHOP in 2014. Today, they're available up to 35% of the employer's premium contribution or the employee premium. In 2014, it goes up to 50%. I'll pause. I'm not sure if I heard a question.
Michael?
Yeah.
What slide are we on?
Slide 7. Sorry. I'm sorry. And just to complicate things more, I'm getting an echo on my iPhone here, so I'm hearing my own voice coming back at me, which is really distracting.
What is the title of your slide 7?
Yeah, slide 7. My apologies.
What is the title?
Products in the exchange.
Okay. Thank you.
All right. We're roughing it today. I'm really sorry I'm not there in person. If you're looking at slide 7, the title says products in the exchange. The third bullet is carrier participation. Common question most employers want to know is who's going to participate in the SHOP, which carriers will be offered. We had a very long list of companies that did to compete in the exchange. It might please you to know that rather than, well, for the state of California or Covered California is acting as an active purchaser, meaning we're requiring the health plan to bid competitively to participate in the exchange. What that means is, rather than just saying, here's what we want to offer, any willing carrier can participate, we have them compete for price, for product, for the provider network, and demonstrate the quality standards that can be met, and of course, competitive pricing, which we think is going to be most effective for California to have the plans compete for your business. And we'll be able to disclose by May 15, maybe the end of May, who will actually be participating. By then, we should be through our bidding selection. And last on slide 7, supplemental dental and vision. We are offering supplemental dental and vision as options. These are not required by the Affordable Care Act, but we know that employers would, many of them offer these benefits today, and makes good sense for us to leverage our buying power on your behalf to negotiate more competitive large group rates. So we'll be announcing that probably in April of 2014, not for the beginning. Moving to slide 8, and the title there is Employer Control and Employee Choice. This slide illustrates what I described earlier, where the employer has the choice of selecting a metal tier. And on the next slide, I'll illustrate what I mean by that, but there's 4 levels of benefits that all plans will be defined by. If you consider it a small business, if you've ever done the purchasing on behalf of your employees for health insurance, it's near impossible to determine whether a plan is a silver, gold, platinum, or bronze quality. Most plans don't have standardized or apples-to-apples benefits. So you may have a $30 copay with one plan that has a $300 deductible, and another plan has a $2,000 deductible, and various different benefits with regard to RX and emergency room and physical therapy, and all the things that are covered or not covered. All of that will be standardized, and it will be a lot easier in 2014 for consumers to compare plans, as every plan in and out of the exchange will be required to be identified under their metal tier. So a plan which has a 60% actuarial value will be clearly labeled as such. Likewise, a platinum plan that has a 90% actuarial value will be labeled as such. And I'll illustrate that on the next slide. So an employer can set a budget based on that metal tier, bronze, silver, gold, platinum, a single tier. The employer sets their plan, and the employees can select their plan of choice within that metal tier. So, for example, if Anthem, Kaiser, HealthNet, any number of plans were all offered on a single menu, the employee can pick and choose based on which plan best suits their need, either network, cost, or whatever other features. And there will be different plan types within those metal tiers. So PPOs, HMOs, HRA, HSA eligible plans, value-based benefits, accountable care organizations or ACOs, narrow networks, full networks. It'll be a pretty full array of choice, including different plan types within a single metal tier. On slide 9, this is the title is Insurance Coverage Trade-Offs, Premium Payments versus Copay Expenses. This helps illustrate what I mean by bronze, silver, gold, and platinum. You know, I know actuarial values are not a common term that we use today, but what this attempts to do is by standardizing plans and having them categorized by quality, it will help the consumer know more clearly whether or not their plan is of a bronze level tier, the equivalent of having 60% coverage, or a 80% or gold tier. And it's today pretty hard to distinguish between one plan and another. If I were there with you today, I would normally ask the crowd if you've ever had this challenge when you're looking at your renewal options and trying to compare one company's $30 PPO plan with another company's $30 PPO plan. It's near impossible to line up the benefits because every carrier has different benefits, deductibles, co-insurance, co-pays. This will help by standardizing it and having them categorized by these levels will help the consumer identify what they're buying. On slide 10, I won't go into much detail there because I think that's already been covered a bit, but that does talk about the shop premium tax credit. I'll say, very briefly that very few employers have taken advantage of the tax credit. I think largely because they don't know about it. And I will give credit to the IRS, who did a pretty good job. I don't think I've ever given credit to the IRS, but the website they have for small businesses actually has some really good, useful information from small businesses to learn how to use and access the tax credit. So I encourage you, if not our website, check out the IRS Small Business Mini site for more information. I'm actually going to move ahead to slide 13. And this slide 13 says, what are the next steps? We're encouraging employers to stay informed and get ready for open enrollment. Technically, the exchanges can open on October 1st. I frankly don't know whether or not the exchange opening day will literally be the 1st, but it'll be there or sometime around that date. But we can't open as early as October 1st. I mentioned earlier the enrollment options are online, phone, fax, or paper. The terrific convenience of being able to enroll online is, I think, a refreshing change for small business. Very few small group or small employers have full access to online enrollment, especially across multiple companies. So if you have it with Kaiser, that's great, but what if you have Kaiser and Anthem, or Kaiser and Blue Shield? You would have two different systems, and even so, they may not allow online shopping and enrollment. Ours will be a single platform for all of the different health plans, So you can shop and compare, enroll, make changes, make edits, manage your bill, make your payments, order ID cards, all of these other self-service features across multiple plans. And while it's very convenient for employers, it also helps drive down the admin waste that is embedded in healthcare costs. Our industry is very paper-laden, so the ability to get more of this done through online enrollment, I think, is going to also help drive some of the waste out of the healthcare spend. Last, on slide 14, I just wanted to show our website. It says for more information, you can visit us at coveredca.com. That's our commercial, consumer-facing website. On there, you have some fact sheets for small business under resources or getting covered. It also has a countdown that lets you know how many days before January of 1st of 2014, and also an invitation for to follow us on Facebook, Twitter, and some YouTube content that's coming shortly. The screenshot at the bottom is our government website, and that's hbex.ca.gov. That's our business website where we have our board meeting information. We're very transparent and very inclusive. If you want to participate in our board meetings, you can, and we invite you to join up on our listserv and attend the meetings online or in person if you're in the Sacramento area. With that, I thank you for your patience with all of it, and I'll stop talking so I can take some questions.
Thank you, Michael. Appreciate it. So we're going to go ahead then and open it up to some questions. I already have some here. Anyone else? Any questions? Okay. Okay, so the first question is the marketplace of the health exchange seems like getting auto insurance. In other words, many options. How can an employer ensure it's meeting federal, state requirements and not getting penalized for offering the minimum? So, Michael, do you want to take that?
Yeah, well, so there's a little muffled, but I think I got the gist of the question. Every health plan offered in covered California will be effectively designated a qualified health plan. So every plan offered in covered California will meet the minimum requirements. I think that's what you were asking.
Yeah, and the question is, how can an employer ensure it's meeting federal, state requirements and not getting penalized for offering the minimum?
I'm afraid I can't hear.
So I'll take this one, Michael, because you covered it for the most part, which is any plan that's going to be offered on the marketplaces will meet all of the minimum criteria for minimum value and for not necessarily affordability, because it's dependent on the individual's affordability, but it will apply to the actuarial values that Michael talked about a few minutes ago, and it will also create or will also meet all the standards for comprehensive coverage. So it will meet all the minimum essential health benefits, and as you heard from Michael in California, you also will have 2 additional benefits of health of dental and vision as well.
Okay, the next question is, can either one describe how the impact of premiums affects future retirees, and do retirees count in the employer headcount of employees?
Federally, for across the board, if you're retired, you do not count on the headcount. So, and there's other options that are available to you, right? Because you're typically in Medicare, or you're typically in, you get your insurance through the individual market. So you won't necessarily be going through the business portals. You won't be covered by the company you retired from. Typically, in some cases that happens, but you don't count against their roles when it comes to employer shared responsibility. But mostly retirees they'll either get their coverage partially through the government, through the Medicare plan, and have supplemental insurance, which is not addressed in ACA. So there's no minimum level of supplemental insurance that you need to hit, or they'll go and get their insurance on the private market, which is the individual marketplace, which Covered California can give you access to as can healthcare.gov.
Okay. The question here says, I understand that small businesses are not required to provide coverage. However, if they do, are they subject to the same requirements as large businesses? In other words, waiting periods, affordability of coverage, minimum value, etc.
Yeah, absolutely. So you have to, the coverage that you provide has to still meet the criteria. Now, the dollar value criteria, the affordability criteria, really applies. That's where you get into the employer shared responsibility aspect. But in order for small businesses to apply for tax credits, in order to be able to be eligible for those tax credits, they do have to meet that standard of coverage. So it has to be any one of the plans that'll be available on the shop or on the marketplaces will meet that standard level of coverage, and the marketplace itself will also do the tax credit calculations and put that in IRS's hands. So anything that you're going to get on the marketplace, anything you get through an agent or broker, typically we'll do this too. The agents or brokers, really want to be helpful in this as well. And so anything that you get through them, they're going to also ensure they'll probably have to still go through the marketplace. We're working on that in order to get the tax credits, but small businesses will still have the same types of constraints that they'll have to in order to get those tax credits to actually to meet. So that's the minimum essential level of coverage, essentially the bronze level on the marketplaces.
So is it 50 plus employees or 51 plus employees?
It is 50. So it's the way. There's a lot of different things that are out there. The way that we've been talking about it is actually 49 or fewer employees is fine. Then 50 and above is where it starts. IRS is constantly taking a look at this number because it does make it makes their calculations a little differently on their projections year on year. The current way that we're defining it is 49 or fewer employees. So 50 or more is one threshold, 49 or fewer is the other threshold.
And so since we're talking about employees, there's a question here that wants to clarify whether independent contractor is considered an employee from the standpoint that if an employer provides, say, office space and requires results, are they considered an independent employee, so therefore not counted as an employee?
That's an interesting question. That's an interesting question. Sorry, go ahead, Michael.
No, they're not.
Michael took did the short road. I was going to go a lot longer than that, but yeah, absolutely.
Yeah, in California they would not be. It would be W-2 employees, independent contractors, 1099 would not, unless there's additional guidance that has some different treatment by other circumstance, where there's a clear employee-employer relationship. Our understanding is no, they would not be.
Ditto.
Okay, thank you. When do pre-existing conditions go away, and is there any underwriting?
Pre-existing conditions go away January of 2014, and no, there is no underwriting. Federally, there's four rating factors that rates could be developed. In California, it's only 3, since we're not using smoker, non-smoker rates. So no longer will they ask health questions or apply anything related to pre-existing conditions for underwriting. That goes away. If you're familiar, in California, we have risk adjustment factors where the rates can go up 10% up or down. That also goes away in 2014.
Okay, thank you, Michael. What if someone purchases a mini med plan? Will this be counted as coverage, or must they purchase a plan in the exchange to meet the Affordable Health Care Act requirement?
Mini meds, by definition, don't meet the minimal essential health benefits or minimum coverage, so they would not satisfy the individual mandate.
It's making my job easy. I like it.
Michael, you're making Saul's, the Fed government's job easy here.
Thanks, buddy.
Well, I'm trying to make up for not being there in the
No. Okay, how will the wellness rebates or discounts work or be accounted for smaller employers?
So in the guidance that has been recently, that has come out, or the NPRM that recently came out, what we've done is we've made the award levels higher. So before you had a cap of 20% of what you could do for your employees, and now it's 30% and it's 50% in smoking cessation. So all of those, that's a one-size-fits-all. There's not a separate standard for small business versus large business, but it just basically allows employers to incentivize their employees for good behavior, right? So you're actually giving a carrot versus a stick. So they increase the amount of physical activity. They hit certain markers within those wellness programs, and they're eligible for a greater benefit, which comes off of their premium. So it was 20% before, it can now be 30% off of their insurance premium. Makes it a little bit easier for the employee by getting into a wellness program and participating and being successful within that wellness program, or going through making sure that they are an active participant to reduce their costs overall at home. Yeah, go ahead.
How is that reported, though? How is that reported by the employer?
So the employer records that. That goes there. That's actually an IRS back office piece, and IRS is working on that. But that will end up going on and saying that there has been we have a workplace wellness program. These employees participated. This is that, and that will all come off of. That will all be reflected on the taxes. IRS has this is one of the things that we talk a lot about. IRS has a huge function in the back office on this. So this is going to. Right now they're in the middle of tax season. We're essentially including a new tax season onto them now with the Affordable Care Act, which they had a nice 8-month cycle before. Now it's a full year. I kid my IRS folks about that. Please don't tell them I said that because they're going to audit me.
So the question here says, United Healthcare came out with an article stating that medical benefit rates could rise between 20 to 50% in California for businesses of 50 employers or less. Is this true? Mike, you want to answer this?
We actually have an actuarial study that came out this week. We commissioned Milliman to do some actuarial analysis to try to pinpoint California's rate. The numbers are all over the place for the individual versus small group market. So for the small group market, it is a number we estimate to be less than 30%. I think the national average seems to be around 35%. But the question is, we'll clarify and know what the carriers will actually be bidding in as early as the end of June or early July. So for coverage effective January, you'll actually know the actual rates in July.
Okay.
So we otherwise have some good technical swag and expertise, but you'll know the exact numbers in July.
Okay. Saul, anything?
No, that's it.
Okay.
So does that mean it's a minimum of 20% is going to go up?
So the question is, does that mean that it's going to go up a minimum of 20%?
I mean, the short answer there is no, right? So it's what you have is you have the carriers that they're preparing for something that they haven't had to prepare for yet, right? So it's sort of, and this is a bad analogy necessarily, but it's sort of the Wild West, where they're trying to meet a level of they're trying to hit a number where it's not going to affect market share, but it's also not going to affect their overall profitability. Because if you come out with a premium level that's too low, they end up losing money in the deal, and especially in a state as large as California, even smaller states, you got to think about how that would affect their bottom line on that. So they're what you see right now, and this is taking off the HHS hat and putting on kind of my consultant hat, which is they're guarding against the potential public backlash of having a higher than normal rate. So if you say 20% and you only raise it 15, all of a sudden you look like you've given a discount, right? So there's a little bit of gamesmanship, not gamesmanship, but there's just a little bit of strategy going on about trying to protect market share, trying to ensure that they can still operate viably as a company. There's a lot of, Covered California just did a study. We've seen a bunch of different studies from a few different operations, and I get a new study each week from folks that send it to me saying, like, this is showing that my rates are going to go up 40% or 35%. I'll tell you a personal story. Is a friend of mine owns a company in Virginia. He's actually the chief operating officer, and he's in the succession plan for being CEO. And their costs, they have about 450 employees. They are government contractors, so they do not meet, they technically meet the number of the employee number for a small business, for SBA's definition of small business, but their revenue is way above what a traditional small business would be, so they're classified as a large business. They're not big enough to self-insure. They're just under the threshold of self-insuring by a couple hundred employees, to where it's profitable, to where it actually saves them money. They got quotes from 4 different health insurance companies last year, including the ones that they had already contracted with. Their insurance company came up with a 40% rate increase. One insurance company came up with a rate increase of 8%, one came up with a 15%, and one came up with a 25%. So it's all over the board, and there's not one real good model that companies are using. But we're seeing a lot of this in the press to sort of mitigate, if we talk about it now, you're socialized to it 6 months down the road. And so I think you're seeing a little bit of that. I don't want to blame the entire argument on that, but I think that that's playing a part in this. It's one of the reasons why I'm out here talking about this, why Michael's talking about this in public, to make sure that folks are aware that, we do understand that there's some consternation, some agita about potential rate increases, and the controls and the processes that the Affordable Care Act has put in place should mitigate those. So you shouldn't, costs may go up. We highly doubt that they're going to go up 40%. It's all going to be market-based. This is all off of the, we're not trying to privatize, we're not trying to federalize the insurance market, so that we're looking at, so you can only make 5% this year. What we're trying, we understand that that's that's an issue, but we really think that you're not going to see a 20% across the board rate increase. And that's one of the things we talk about with rate review and some of the MLR stuff. If they do charge you more, MLR protects you in the consumers, and that you're going to get a check back in August for the amount that they're over that 80%. So you got to think about it that way as well, or under that 80%.
Any effect of the Affordable Care Act on health savings account or flexible spending accounts? In other words, will they still be available?
I think I heard the question, and plans that will be plans in the exchange that will be eligible for HRA and HSAs. I think the question yet to be answered is to what extent we might offer a bundled offering where we offer both the high deductible plan and the administrator. So that's the detail we're still working on.
Okay. Next question is, if I pay full cost for my husband's health care plan through payroll deduction, is there a tax credit through the Affordable Care Act on my 2012 taxes?
So I just want to clarify this question real quick. Not a small business owner getting your spouse's coverage through your employer for 2012. If they don't, the short answer is no. There's not a tax credit available. The only tax credits that are available right now are the small business tax credits. Starting next year, the tax credits that are available are premium credits that are available on the individual marketplace. So if you get it through your employer, if you get spousal coverage through the employer, then no, that still won't have a tax credit applied with it. It's only if that spouse goes on the individual marketplace, buys their insurance there, and also meets all the qualifications for an advanced premium tax credit.
Michael, this question is for you. In California, is tobacco use one of the factors used to determine premium rates?
It could be. The Federal Affordable Care Act allows states to take advantage of smoker discounts or have smoker and non-smoker rates. It would require state legislation in order for us to do that. And I must admit, to my surprise, you would think California would be ready to do that. Not so quickly. So not until we get state legislation will we be able to use smoker, non-smoker rates.
Okay. If someone does not sign up by March 31st, 2014, is she not able to get insurance until 2015?
No, that's not the case. You can still get insurance. However, that March 31st deadline, that's when the individual responsibility provision kicks in. So after March 31st, the clock starts running on from IRS towards the individual on making sure that they have coverage. So the base responsibility payment for individuals for 2014 is $95. That's per year. So you would divide that by 12, and so each month the IRS would then be assessing that that payment on next year's taxes. So that's how that would come into place. You're able to get coverage at any time during the year. March 31st is when the clock starts running on having on making sure that you actually have insurance and that you are participating in the marketplace or participating just in the insurance pools.
Okay, we kind of answered, or you kind of answered some of these questions, but this is like a three-part question. Do all plans in a given tier have the same cost? Does an employer contribute a percentage, a fixed amount of cost? And lastly, can employees use employer contributions to purchase a higher medical plan?
First two questions, and I'll let Michael address the third if he wants. The first two, which were, give me that again? Here we go. So all plans in a given tier have the same cost. No, they have to cover, they are all the same actuarial value. So that they will all be the same, they'll all have essentially the same types of benefits, the same level of benefits, but it's really, the actuarial value, put simply, is how much, your premium is per month versus how much you're paying out of pocket for co-pays and individual procedures, right? So on a silver plan, which is 70% and 30%, you have a 30% copay on your procedures, so you have a little bit lower out of pocket, or a little bit higher out of pocket than your bronze, but lower than like than a gold or a silver plan and an 80-20 plan. But that's up to the insurance company to determine their rates on that. So, you could get on the marketplace, you can see 3 different companies have 3 different rates, and you can go for the company that has the lowest rate. This is that whole market share profitability kind of teeter-totter that I was describing a couple minutes ago. So not all the same plans will have the exact same cost. I'm sure they will all be competitive because all these insurance companies will probably be working from very closely created models to figure out their costs. Does employer contribute a percentage of fixed amount of costs? Yes, the employer on the small business marketplace, the employer puts in what they want to contribute, and the market, and as long as it falls within the acceptable levels of making sure that the value doesn't exceed that the payment doesn't exceed the employer's 9.5% of their salary, what we talked about earlier, then they're not open to any of the responsibility payments if they're over 50 employees. But yes, the employer can contribute a percentage of the fixed amount of contribute a percentage of the fixed amount of costs. And Michael, the last part of that was, can employees use employer contributions to purchase a higher metal plan? I think this is a state-by-state question, so I think it's probably better for you to answer that one.
Yeah, so we arrived at our, what we call employee choice, through a process of, we presented to stakeholders and both consumer groups, small business advocates, and the insurance carriers themselves, a series of options. There are no less than 6 different employee choice options. The one that we landed on was the one that is required by the Fed, which is a single tier. So the employer offers a single tier, employee picks any plan within the tier. We are exploring and still considering other options that might offer 2 tiers. So, for example, if an employer were not satisfied with just a silver, a gold, a single tier, they might be able to offer 2 adjacent tiers, like silver and gold, or gold and platinum, bronze and silver. We believe that we'll probably offer something like that in mid-2014 or 2015. There are, and you may have seen some articles in the news around the HHS allowing states to delay offering employee choice, which would basically mean an exchange would offer to their employees just one plan. That doesn't make for much of an exchange, and we covered California, are not delaying the offering of employee choice. We're going to go ahead with what we originally planned and allow employers to offer multiple plans but in a single tier.
Okay, thank you, Michael. Any other, we have one more question. Anyone else have a question? No? Okay, Michael, this is a really tough technical question and saved it last for you. And the question is, will you send your PowerPoint presentation to the attendees? Do we have your permission?
Yes.
Okay. Yeah, it's a tough technical question given the technical difficulties this morning.
No, I got it. I got it.
So, okay, well, Saul and Michael, thank you very much for being with us this morning, and again to Palo Alto Medical Foundation for hosting, and El Camino, Lucille Packard Children, and Kaiser as well. So, thank you, everyone. Oh, wait, sorry.
I just wanted to add one additional point, because a couple times we talked about what can be used to determine what you pay, but we've never said what the plans can use to determine what you pay. There's 3 factors, and it's age, family size, and geography. And those are the only factors that can be used to determine what the cost of a plan is to an individual.
Can't swoop it in for, you know.
Yeah. Boy, I come from a family of 10, so I'm kind of screwed. Just kidding. So anyways, okay, well, thank you very much again. Thank you everyone for attending. Enjoy the rest.